can take place from the presynaptic neuron to the postsynaptic neuron by release of the neurotransmitters. Now, within the presynaptic neuron, the neurotransmitters are stored into the storage vesicles, and these neurotransmitters can be released, which is controlled by the voltage-gated calcium channels which are present on the presynaptic nerve terminals. So these ion channels are what we call the voltage-gated calcium channels, because these are going to be opened based on the voltage of the presynaptic neurons. Similarly, the postsynaptic neurons can be equipped with a few of the receptors. For example, NMDA receptors, which are the receptors for the glutamate, which produce a excitatory postsynaptic potential. And the receptors are the AMP receptors, which are again producing the fast excitatory postsynaptic potential. So these two receptors, when they are going to be activated by the glutamate, they can produce the excitatory response within the postsynaptic neuron. Now, whenever the impulse is going to reach to the presynaptic neuron, these voltage-gated calcium channels are going to be activated. Now the calcium can enter through the voltage-gated calcium channels, and it can produce a depolarization of the presynaptic neurons. Once the presynaptic neurons are depolarized, they promote the release of the neurotransmitter from the storage vesicles. Now these neurotransmitters are going to acting on the postsynaptic receptors, thereby they produce a depolarization or excitation within the postsynaptic neuron. In this way, the neurotransmitters can be released from the presynaptic neuron, which is stimulated by voltage-gated calcium channels. But what happens in the epilepsy and neuropathic pain? Whenever the more number of impulses are going to reach to the presynaptic neuron, then this presynaptic neuron will be in a hyper-excited state. So that's what we call the hyper-excited presynaptic neuron. And this can result in the activation of the calcium channels, that is the voltage-gated calcium channels, which are opened, resulting in the more release of the neurotransmitters. In this way, as the impulse are going to reach to the presynaptic neuron, more neurotransmitters are released, leading to the abnormal postsynaptic neuronal excitation. So this may be observed as an excessive pain as well as increased epilepsy in the patients. Now let us see how this pregabalin acts. So this is a presynaptic neuron and this is a postsynaptic neuron. Within the presynaptic neuron, voltage-gated calcium channels are important for release of the neurotransmitters. But these ion channels are having a modulatory site, and this site is called alpha to delta site. So this site is going to modulate the entry of the calcium through the voltage-gated calcium channels. Now when we use the pregabalin, this pregabalin can bind to this alpha to delta site on this voltage-gated calcium channels, and it can modulate these channels so that these channels are going to be inactivated. Now in this condition, whenever an impulse is going to reach to the presynaptic neuron, it cannot promote the entry of the calcium because the calcium channels are closed, so that the calcium is not entering into the presynaptic neuron and neurotransmitters are not released. In this way, pregabalin can inhibit the release of the neurotransmitters, so it can inhibit the postsynaptic neuronal excitation. That's why pregabalin is a modulator on the voltage-gated calcium channels, thereby it can decrease the neuronal response. In this way, pregabalin can decrease the nociception as well as the epileptic conditions.